afternoon, everyone. My name is Brenda Suggett, and I'm the Executive Director of CARSP, and I'd like to welcome you to our webinar today that is looking at the cost of injury in Canada and Vision Zero work across Canada as well. And we have two staff here from Parachute Canada, Valerie Smith and Stephanie Cowell, and I will introduce them in a minute. But first of all, I would like to say a little plug for our conference. We just sent out an email announcing that the call for abstracts as well as the sponsorship opportunities are open. The conference is going to be from June 19th to the 22nd in Sudbury, Ontario, and it is an in-person conference. We're very excited to actually plan something where we can see each other in person, which is going to be awesome. I think we've all been missing that. And now to get back to our webinar, and I just want to mention that the webinar is part of our Knowledge Exchange and Training Hub project, which is funded through Transport Canada. And it is the second in a series of monthly webinars. So I'm very excited that we are able to give these webinars on a regular basis. And now to the two presenters. So Stephanie Cowell has spent more than a decade working in the area of injury and trauma prevention. She is the Director of Knowledge Translation at Parachute, leading the analysis and synthesis of research to develop the organization's evidence-based solutions that advocate and educate. Stephanie's experience includes working with government, health, sport, and education stakeholders at national and provincial levels. Stephanie is a speaker and presenter at conferences and workshops and a media spokesperson on a wide range of injury prevention topics, public policy issues, and knowledge mobilization. Stephanie holds an honors bachelor's degree in sociocultural anthropology from Wilfrid Laurier University and knowledge translation professional certificate from the University of Toronto. Welcome, Stephanie. And our second presenter is Valerie Smith. Valerie is the Director of Programs at Parachute. She oversees all of Parachute's campaigns and programs and helps to support our extensive network of community partners across Canada. She is skilled in managing behavior change programs with a focus on children and youth. She also has a strong community engagement background and provides solid leadership to our network partners. Valerie has presented at a number of events and conferences around the world on injury prevention issues. Prior to working with Parachute, Valerie was a senior program manager at a number of charities, including Smart Risk, Katimavik, and Youth Challenge International. She spent a substantial part of her career working on HIV/AIDS programs in South America and East Africa. She holds an MA in International and Comparative Education. And now I'd like to pass it over to Steph, who will be doing a land acknowledgement. Thank you, Steph.
Thank you so much, Brenda, and hello, everyone. We would like to begin the session today by acknowledging the land. We'll begin with the land on which Parachute's offices are located. For thousands of years, it has been the traditional territory of the Wendat, the Anishinaabeg, the Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. Today, this land is still home to many Indigenous peoples, and we are grateful to have the opportunity to work on this land. While we meet today on a virtual platform, we do encourage you all to take a moment to acknowledge the importance of the lands which we each call home. From coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. For the session today, Val and I are going to focus on a couple of components related to transport injury and road safety. As Brenda mentioned, Val and I are both from Parachute, which is Canada's national charity dedicated to preventing serious and fatal injuries. And our vision is that everyone living in Canada has the opportunity to live a long life to the fullest. Within injury prevention, our organization has a certain number of priority areas that we focus on. And one of those areas is road safety and transport safety. This is one of the leading causes of injury and injury-related death in Canada, and a serious public health issue that demands our attention. To begin, I want to talk about the fact that if we are going to address any injury issue, but including road safety, to be truly effective, prevention needs to be driven by evidence. And the way that we approach prevention at Parachute is by applying a public health approach that understands the issue as well as the evidence that exists to address the issue, while also evaluating any actions that we are taking. So where do data fit within this picture, and why are data so important to prevention? And why do we want to talk about newly available data today and share that with you for the work that you're doing? Well, first of all, we need to understand the size and the nature of the problem that we'd like to address. What kind of injuries are occurring? How frequent are they? How serious are they? What's causing them? Who is getting injured? Does age matter? Does sex and gender matter? What factors are at play? When we can have this understanding of the issue, this helps us create a blueprint for identifying and implementing strategies we can use to reduce risk of injury, and use strategies that are evidence informed to apply to the context that we're looking to address. And if we don't know what the picture looks like before implementing strategies, we can't possibly know how it compares after. Are we making a difference? So for all of these reasons, paying attention to the data and the evidence in the literature, as well as continuing to update our knowledge of these things, revisit these things. This is a dynamic and ongoing process to understand issues as they change, evolve, and new issues emerge. Paying attention to the data is important to drive the work that we do. So I'm pleased to talk to you today about a new data report that we released earlier this year in July, the Cost of Injury in Canada report. Now, this is the fourth such report that has been released since 1998. And the last time we released the report was 2015. And some of you may have accessed the report at that time. This version we developed with the BC Injury Research and Prevention Unit, who helped us with the data analysis. So our huge thanks to them as our partners. And we could not have done this without the support as well as the expertise of the Public Health Agency of Canada. I want to explain a little bit about the methodology of the report, though I will just give some highlights, and a full methodology is available on our website alongside the report. So those of you who are interested in these aspects of data, data visualization and data collection and presentation, we've got lots of that information for you. But for those of you that this puts them to sleep, I'll just touch on a couple of things I think are important to mention. So the report presents data at a national level. And it presents the data year 2018, which is the most recent year we were able to have available for all the different types of data we wanted to include the report to be able to present them all for the same calendar year. We use health system data to identify injury cases. And so some of you may perhaps work with collision data or transport data. I wanted to differentiate that the data that we use for this report is coming from health administration data. So data that is collected and coded within our hospitals as well as coroners' offices. The way that we identify injuries within deaths and hospital cases, and the way that we also identify the identified cause of the injury is by using a coding system called ICD-10. ICD stands for the International Classification of Diseases, and this is a coding system developed by the World Health Organization, and it's used in Canada as well as all around the world to code health system information. In the report, we look at emergency department visits, hospitalizations, and deaths related to injury. And on the screen, I've showed you the database sources that these data come from. So the National Ambulatory Care Reporting System for emergency department visits, the Discharge Abstract Database for hospitalizations, and the Vital Statistics Database through Statistics Canada for deaths. We have a particular tool we use to take those cases and apply cost information to them and to come up with the costs that we present in the report. And that tool is known as ERAT. And this is a tool that we've been using for a few years, and we did have validated a few years ago to continue using it. And as I said, it takes the cases that we pull from the health data and combines it with other data that we have, for example, average hospital stay costs, physician fee costs, and also information from the literature that tells us about some standard costs. This is a very similar methodology that's used by the Public Health Agency of Canada for their broader cost of illness studies as well, if you're familiar with those. There are a couple kinds of costs that we present in the report. Direct costs, those include direct costs to the healthcare system. So if you think about anything involved in that care, so your ambulance to the emergency department, the physicians and healthcare providers that provide treatment, the different services provided while you're at the hospital. Indirect costs, we're looking at this from a societal level. And so indirect costs are primarily defined by losses of productivity to the workforce, mainly through lost wages that could be earned. You'll notice that in this, one thing we absolutely cannot put a cost on to quantify is the human cost of the tragedies that we see on our roads and through other causes of injury. We can't possibly quantify what it's like to lose a loved one, to lose someone in the community, or to have someone whose life is permanently affected by injury. So of course, this is just an absolute underestimate of the true cost of injuries. In the past, we've presented the report as a PDF file. As it is 2021 and we're trying to think about new ways to allow people to access information, the report is now entirely online through HTML content, as well as an interactive data visualization. And this is great because it does allow you to filter the charts and tables by age, sex, and cause, as well as some measures. So rather than having static tables, they're more customizable to look for the information that you're looking for. The report is also fully available in English and French, and you can access it on our website at parachute.ca. So what are the key findings of the report? I'm going to talk about some of the findings for injury overall to put it in context, and I'll go into some specific data about transport injuries. So as a whole, and these totals are for a single year, injuries result in more than 17,000 deaths in Canada. And that makes injuries the #1 cause of death for those aged 1 to 44 in our country. And when we look at all ages overall, the leading causes of death in Canada, injury comes in at 3rd, just behind cancer and heart disease. So it's a significant issue that needs our attention. As you can see from the other numbers, the number of serious injuries resulting in hospitalization, as well as other injuries resulting in emergency visits, the numbers are just absolutely huge. And that's the human aspect of the lives that are affected. And when we look at the economic aspect of this, injuries cost $29.4 billion to the Canadian economy in a single year. And again, when we break those down by direct and indirect costs, most of that is direct costs to our healthcare system. $20.4 billion to our healthcare. And I think we've all really learned over the past year and a half with the COVID-19 pandemic, how critical our health system resources are. And, if we know that things are preventable, that we can reserve those resources, those beds, those treatments for issues that are of public crisis. If we can prevent injuries and save those resources, that's something we need to focus on. And injuries are certainly an opportunity for prevention to save both lives and costs. We're talking about, just for injuries alone, spending $56 million per day in our healthcare system for something preventable. When we look at the causes of injury and we consider cost, where do these fall in? Well, falls by far and away contribute the most to the total cost of injury, more than a third of the total cost of injury in Canada. But you'll also notice that transport comes in second at $3.6 billion, which is nothing to shake your head at. So, simply focusing on cost, if we addressed falls and transport incidents, these causes of injury as public health issues, we would be addressing, almost half of the total cost of injury in economic terms. When we look at the actual cases and the different injury outcomes, you'll notice that transport injuries, again, rank high compared to other causes of injury. In most cases, they are second to falls. You'll notice that now transport incidents rank fourth in terms of causes of injury death in Canada. And for the first time, this is a change. We don't usually see big changes in these rankings over the year. And for many, many years, transport incidents have been the third leading cause. What's led to the change? Well, unfortunately, we have seen a more than doubling of poisoning deaths in the last decade, largely attributable to the opioid crisis. So while we have seen transport deaths trend a little downward, the result of this change has been, unfortunately, the rise of a new absolute crisis in terms of the opioid epidemic. It's important then that we kind of break this down further within transport and look at what are the types of incidents. Now, the health data don't give us complete contextual information, unfortunately, but they do tell us a little bit more. So if we look at transport type, we can understand where a lot of the injuries are stemming from. I doubt it will be a big surprise to this group that its motor vehicle collisions are the largest contributor to transport deaths. And we can also pay attention to that high number of pedestrian deaths as well. You'll see a large grouping here for other transport. That is a bit of a catch-all category. That would include things like railway, water transport, so boating incidents, air transport, horse and buggy collisions, other things of that nature. And again, when we think about hospitalizations, which often we use as a way to consider more serious injuries, again, we have motor vehicle collisions leading the way, but then you'll also notice that ATV snowmobile incidents, as well as cycling, which here is a little awkward, called pedal cycle, but technically it includes tricycles. So that's the technicality of the data definitions, but it's largely cycling incidents you'll see there. And again, accessing the report on our website, you'll be able to pull all of the hard numbers for these visualizations. One of the things important to look at is where is this distributed in terms of the age of our population. So I'm going to start with rates. Rates are important because they allow us to take into account the size of the population at each age. So, we have more adults and seniors than we have children under the age of 15 in our country. But when we use rates, then we control for the population and say, okay, comparing apples to apples a little bit in terms of population size, who is, being injured, being hospitalized, or losing their lives at a higher rate than others. And we can see by the rates looking at deaths and hospitalization that our oldest citizens, as well as our youth and young adults, have higher rates than others in terms of deaths and serious injuries. So these are really populations that we need to pay careful attention to and prioritize. When we break these groups down even further, then we see that our oldest seniors have the highest rates. Those that are 75 plus have the highest rates within the seniors population. And then within the youth and young adults, it's that 20 to 24 age group that has a high rate as well, just after the senior population. When we look at emergency department visits, that's where we see, high rates in that 15 to 24 age group again. So, and as we look into break down the children's group more, we actually see a high emergency department visit rate among those 10 to 14 years old. So again, thinking about who's most affected by these injuries in terms of rate and why we might want to prioritize the safety of certain groups. Not that one life is more valuable than the other, but figuring out and targeting where we can intervene. It's also important that we look at the number of cases in terms of the rates, not to kind of compare across ages, but Vision Zero, the principle behind Vision Zero tells us that no death on our roads is acceptable. No serious injury is acceptable. And so we don't want to discount the actual numbers. Each of these numbers represents a person. So we do see, these really high numbers in the adult population. When we break down that total of $3.6 billion cost for transport injuries, like many other injuries, we do see more than half of that going to direct healthcare costs, and transport injuries as a whole represent 12% of the total cost of injury in Canada. And again, if we break that cost further down, looking at the different types of transport mode, type of transport incidents that cause injury, again, no surprise because the numbers are so high. Motor vehicle collisions have the highest cost at $1.9 billion. I do want to draw attention on this slide that is in billions, while the others are in millions, just to make sure to highlight that difference. And so, but still, I mean, the cost that you look at all of the different types of transport incidents, these costs are immense on top of the human cost. So what do I want you to take away from this, other than really encouraging you to check out the report and exploring the data that are available? This is a tool that's freely available for you to use. It can be really helpful, whether it's for your priority setting, whether it's for writing reports, making cases for funding, things like that. These data and the findings are available to you to use as a tool to advocate for the work that you do, for the changes that you want to see. So we really welcome you to use the tool, and we're here to support if there are things you're looking for that would help you use this in your work. My key messages, my key takeaways for you today, really the data just show that transport injuries in Canada have an immense human and economic cost. Again, more than 1,700 lives lost per year, that these are disproportionately affecting our children, our youth, and our seniors. And we can't ignore the economic cost of $3.6 billion a year. And at the end of the day, these costs, both human and economic, are unacceptable and they're preventable. So, when we talk about prevention, well, what does that mean? In terms of overall, speaking about prevention practice, we all need to be champions, no matter what your role is, whether you're a decision maker, a funder, someone working in the community on the ground. We need to advocate for laws, for built environment changes, for more spaces in our communities that create opportunities for us to travel, work, play without serious harm. We need to invest in preventative measures that we know work, like Vision Zero, safe system approaches, and other interventions that have great evidence of working to reduce harm on our roads. And finally, we do need to continue with data surveillance and research to continue understanding the issue and continuing to grow our evidence of what we know is effective. And so with that, I'm going to pass it on to Val, who's going to talk more about Vision Zero, some of the work that's happening across Canada, and what all of this means when we talk about doing the work in our communities and on the ground. So over to you, Val.
Thanks, Steph. Okay, so I just wanted to start off saying this is a timely presentation for Car Spend Parachute. Thursday, October 28th is the launch of the global plan for the Decade of Action for Road Safety that will take us to 2030. Some of the goals set out are based on a 50% reduction in serious injury and death on our roads. On the 28th, Car Spend Parachute will be issuing a media release showing our support for the global decade. And Vision Zero and the safe systems approach is very much embraced as an approach in the plan that governments are being encouraged to implement across throughout the world. So great segue into presentation. Thanks, Steph, for the information. And I just want to start off by saying, by using this quote by Gary Shimko from Edmonton, which really speaks to Steph's focus on the need for prevention. So why wait for crashes if you can mitigate the conflicts right off the top? Next slide, please, Steph. So I'm assuming that this audience is familiar with Vision Zero. I had a look at the participants and I'm going to keep that assumption. As we know, these are some of the evidence-based interventions that come with a Vision Zero approach, speed reduction, improving our road infrastructure, looking at improving technology in our cars, really trying to protect our vulnerable road users, cyclists and pedestrians, and then education and enforcement around driver behavior, seatbelts, distracted driving, impaired driving. Next slide. So today I'm going to focus, and I'm going to go through the slides fairly promptly. I'm going to focus in on the Canadian landscape, which is a document that Parachute produced in collaboration with a number of stakeholders. We met with 24 jurisdictions who were in some stage of implementing or considering Vision Zero, including, and we also did 14 interviews with road safety policymakers and stakeholders from these cities. Next slide, please. So why Canadian landscape? Why did we do this document? So what we found and what our stakeholders told us was that there was a lack of reporting on the overall Canadian landscape on Vision Zero. There was a need for one document that's going to profile all the jurisdictions that have adopted or were considering adopted Vision Zero. People wanted to know real life experiences and insights from the front lines, from the cities, that we're trying to make big changes using a safe systems Vision Zero approach. And so this landscape was really an opportunity to share and disseminate successes, challenges, and opportunities faced by jurisdictions embracing Vision Zero. What did we do to produce this report? We did a very big scan of the literature in Canada on Vision Zero. We then, as I said, conducted key informant interviews with 14 jurisdictions. We documented and summarized their experiences in this document. Next slide, please. This map, I'm not going to go through all the cities that have embraced or formally adopted it, although at this point there's 9, from our understanding, 19 jurisdictions. which could be a municipality or a province, as well as 6 that are in process. There's always more happening. There's cities we're not aware of. So have a look at this map. Each city that's implementing or adopting, we've also included their road traffic safety planning reports, as well as any other associated documentation to go with Vision Zero. If anyone sees that we're missing anything, that you're aware of a new city or area doing Vision Zero, please let us know. Next slide, please. So really high level, before I get into the weeds, some of the key findings won't be a surprise to anyone here. Obviously, Vision Zero in Canada is a complex landscape. Canada in general is a complex landscape. One of the big challenges with implementing consistent Vision Zero practices and policies is the dichotomy between rural and urban, but even between north and south and east and west in our country. Our roads are controlled in a variety of ways, with some control being shared to provincial, some to the municipal governments, and often or sometimes there's conflict there in terms of what needs to be done. Varying levels of commitment and budget, as we often hear. So the implementation really varies at so many levels. One city doing Vision Zero could be doing it in quite a different way than another city of a similar size. And because of this, we do hear of Vision Zero being criticized, some areas embracing the term Vision Zero, and being accused of tokenism and so forth, because they may not be adopting it or implementing policies that are aligned with a safe systems approach. Next slide. So I'm going to hop right into challenges and successes, and my presentation from here forward is really based on different testimonials and shares from our folks we interviewed. So I'll start with implementing in rural and multi-jurisdictional areas. So Sean out in Grand Prairie talks about the importance of, as a small municipality, working with others, other municipalities or towns close by, because collectively it's much easier, according to Sean, to embrace Vision Zero. And so if you're in a small rural area or a small town, look to see what everyone else is doing around you and try to build something collectively. Next slide. Getting public support. So we all know this is extremely important. So Beth in Brantford says, one challenge is public opposition to road safety improvements. A change in approach has been to incorporate a public feedback process, including ward meetings with the support of local councillors. So this quote is all about the importance of including stakeholders and people within your jurisdiction so that they understand why we're making these changes in the roads. Why are we reducing speed in certain areas? Because the more people understand and recognize that there's data driving a lot of these changes, the idea is that there's going to be more buy-in. Next slide. Changing the way we think about road design. So again, people working within Vision Zero, engineers, public health, enforcement, everyone has a different perspective of how our roads should be designed. So changing the way we think about road design. So here, Dave Ferguson in Hamilton, change is the biggest challenge in changing behaviors to the present. Many municipalities have a traffic operations first mentality. Traditionally, that has been how we've operated, but times have changed and more focus is provided on complete and livable streets with vibrant core areas that encourage pedestrians and cyclists. So again, we've seen a lot of this during COVID-19, and there's been a lot of engagement around the need to really think about building and using our roads differently to support multimodal road users and not just cars. Next slide, please. access to data. So we hear this over and over again. So this comes from Aaron in BC, just about, I won't read this whole quote, but just the extreme importance in collecting data so that we can really get an idea of the big picture on why collisions are occurring and where. We often hear of hotspots and using data properly where possible, where you can access the data, and then building out potentially interventions that work in those specific areas, because one fix doesn't work for all, as we know. Cross-sector collaboration. So this speaks to Dave's earlier point. So collaboration with the public health sector is crucial for advancing road safety. For example, the health sector collects data on injury severity and characteristics and offers insight into how to prevent and reduce the severity of injuries. Integrating and including this perspective in road safety analysis is imperative. And this is from Colleen in Road Safety BC. And Vision Zero very much embraces a public health perspective, while still absolutely respecting perspectives of others in the field, such as engineers and enforcement. Next slide. A strong Vision Zero leadership. So this is from Gary in Edmonton. When management says everyone is here at the table, we're all going to work on Vision Zero. So whether you're standing the street, designing streetlights, or painting lines, the goal is zero. So this quote really speaks to the importance of having a champion and a strong leader at the top, helping to bring all the stakeholders together. Communicating success. So here we have Tony from Calgary, and he speaks to the importance of getting back successes to your stakeholders, just to keep people motivated and to continue to get buy-in for what we're doing, especially when we're making bigger systemic changes that are impacting a lot of people using the roads. Annual report back to council was good. It was a good opportunity to communicate back what we had done. It showed the evaluations that we've been doing and things that were having value to build trust. So Tony speaks about rectangular rapid flashing beacons and pedestrian beacons really being something that was proven to be valuable in the area he was working, and he wanted to get this back to his constituents. Next slide. And he also had some insight into, and I wanted to share this more as something interesting, but something Tony found effective when he was in this role was modular traffic devices that they put out in Calgary at a very low cost. So 1/10 of cost of permanent traffic calming measures. And these demonstrated the opportunity of the environment to change pedestrian behaviors in a very cost-effective way. Tony actually got a lot of press. Tony and the city of Calgary got a lot of press about these devices. Next slide, please. So Vision Zero Solutions as a whole engage constituents, and key stakeholders to raise awareness and build public support for Vision Zero. Be persistent, be patient. We all know this is not a quick process. Things take time. When we're working with government officials and multiple diverse stakeholders, we need time and we need patience and collaboration. Identify and align Vision Zero with other strategic priorities. What are folks doing in the sustainable transport area? How about climate change, chronic disease prevention? What are they doing? How can we all work together to deliver stronger safe systems reports in our areas? Identify quick wins and short-term goals, build momentum, as well as a longer-term plan. I just pulled these out. I'm running out of time. I pulled out, I went through the report again a few days ago, and I pulled out what I saw as very consistent countermeasures being used. I'm not saying these are the best countermeasures, but it's what we found most cities using or implementing Vision Zero were using. So protected and extended bike lanes, enhanced pavement markings, zebra crossings, bike boxes, speed and driver feedback signs, enhanced signage in school zones. So a lot of cities are doing a lot of school zone work, not just within the school zone actually, but expanding their work outside the school zone to protect vulnerable road users further away from the immediate surroundings of a school. Automated photo enforcement and red light cameras, and enhanced pedestrian signals. So thank you. This was taken from a recent communication campaign we did in collaboration with one of our key partners and sponsors, Desjardins. And it was really to reinforce that key message around Vision Zero, is that we can get to zero deaths on our road, and we can work together to not only get to zero deaths, but to reduce serious and catastrophic injuries, because circling back to what Steph shared, the numbers are extremely high, and each of those numbers and statistics is a person with a family, and it's important that we don't accept the status quo for what's happening on our roads right now. And we feel, along with our stakeholders, that now is a extremely timely period to really try to go out and make some change, and work with our partners and our colleagues and our government to really look at using and designing our roads differently. Thank you very much. And thank you to CARSP for inviting Parachute to do this presentation.
Well, thank you so much, Valerie, for that excellent presentation, and you too, Stephanie. Very insightful, a lot of information in a short amount of time. And now we're going to open it up to questions. And if people could use the Q&A feature in the bottom of the screen, that would be great. And I have a couple of questions to tide us over until we start to see them come in. First of all, for Stephanie, very insightful and great information, as you say, that you can take to governments, to partners, anyone you're trying to collaborate with and produce change, or you're trying to win someone over to enact some new legislation or something. Just wondering if there's ever been a report that compares, like the different, you said this has been done 4 times, the last 2018. Have you looked at any comparison figures over time between the different reports?
Yeah, that's something that we did in the 2015 report. What we did for that at that time was use the exact same methodology and the exact same content as our 2009 report, so that we were able to compare data across those years, and you can find that on our website as well. We haven't made direct comparisons in the new report to the old because we did update our methodology, so we couldn't directly compare those, but we can dig into, if we look at rates for different data sets, things like that, we can look at trends over time. And so, there are some encouraging trends across injury prevention. Unfortunately, I mentioned that, the issue of poisoning on the rise. Transport, as you know, over the decades has reduced, particularly in certain provinces. And so, we would like to see those lowered, but they are trending in the right direction. But at the end of the day, the costs that we're seeing on the economic side, continue to grow over the years. And, we have lots of knowledge about what works, and what we really need is to take that knowledge and put it in place. And that means resources. We need funds, we need capacity, we need people power, we need, decisions passed in our communities to allow this prevention to be prioritized and happening, which is really exciting to see with Vision Zero. When cities come on board, seeing the commitment needs to be budget and resources and time to see that change happen. So part of advocating for Vision Zero in particular is really advocating and clarifying that a commitment to Vision Zero means a commitment of those resources, or the change simply won't happen. We can't wish it away.
Very good point. And we don't expect these things to change overnight. They take time, and often multiple interventions occurring at once too is a better approach. Well, we're starting to see some questions coming in, and I have one from Lisa King, and she first of all thanks you both for your presentation, and she wonders if there's any specific data on the cost of motorcycle injuries and deaths, and also interventions specific to motorcycle safety. So I'll let you guys decide which one to answer.
Yeah.
In terms of this particular report, motorcycles would be grouped under motor vehicles. However, it is possible to look at motorcycle data. I believe that Transport Canada's motor vehicle statistics does break things down by vehicle type. So there's information available there. A lot of times, I'm not sure where you're located, but a lot of times police collision data locally will tell you that. So for example, if you're in Ontario, OPP does have annual road data reports, and they include things like that. So there are places. If this is something you're specifically looking for, please don't hesitate to reach out to Val or I. We'd be happy to help identify places to get that data for you. In particular, at the moment, on the top of my head, I don't have intervention specific to motorcycle safety other than the improvements we've seen over the years in terms of protective equipment, and speed is a major factor. But Val, I don't know if you have anything to add there on the intervention side.
No, I don't, but that's a really great question. And I know on CARSP, we have a number of people advocating around motorcycle safety. And so maybe, Brenda, that's something we can also look a little further into amongst our own constituents at CARSP.
Yeah, very good point, Val. I agree. I think that it is a topic that's definitely important for certain groups, and it's something that we will look into more. And next I have a question from Brian Jonah, and it's for Stephanie. And she asks, or I should say he asks, how does the data on fatalities and injuries in the health-related databases compare with those collected by the police collision reports?
That's a great question. And there's always we're always having interesting conversations and examination of the different data sets that are available across Canada, and often for all sorts of injury prevention, we have to piece the picture together from different data sets, and they kind of they tend to have different approaches. And so this is something specifically we've had some discussions with the government, as well as asking questions to TURF and Transport Canada and other partners about, and certainly have a goal to, I mean, the ideal would be to have these data aligned and linked so that we could connect the dots and get all the information aligned up. In the meantime, the primary difference is just kind of the way that a cause of injury might be defined. So for example, in the health system data, the way a cause is defined, we would see a separation, for example, of an unintentional collision and, for example, someone who through their vehicle dies by suicide or self-harm. Those would be separated as different causes. So the transport incident data that I presented today does not include any intentional inflicted acts of either self-harm or, for example, vehicular assault. Whereas in the police or transport data, those would all be considered transport cases. So the numbers will present slightly different because they might be categorized differently and just the way that those get defined. They're usually, in similar ballparks, but there are some different definitions that we use for the different purposes that the data sets are meant to serve.
Okay, great, thanks. And this is a follow-up question also from Brian. And he was wondering if it is not possible to separate road collision fatalities and injuries from those occurring in other transport modes.
So we have separated to a certain extent in terms of, I guess, we've separated out motor vehicle, pedestrian, and cyclists. Within kind of the other category, there are still some on-road pieces there. It gets a little complicated to explain in terms of how the coding works and how it gets pulled and how certain numbers get small. So there's reasons that the data are grouped in certain ways. Ultimately, someone with access to all of, for example, the hospitalization data, could they drill down a bit more? Yes, but it's a little more complex, and the numbers get smaller and smaller as we divvy it up. So I'm not sure that's a great answer. I'm always happy, Brian, if you wanted to connect afterwards to talk more about the data. And there's a lot more challenges than there are probably great opportunities right now. We're always hoping to advocate to improve the data that we have, but they are presented in certain typical ways to try and capture the biggest, most relevant picture. So I guess I can leave that there.
Great, thank you. And if everybody could keep the questions coming in, that would be great. And I just have another question for Stephanie, and it's whether there's any plans to look at these numbers by province. And I noticed that the 15 to 24-year-old age group is such responsible for a very high proportion of all the potential years of life loss, deaths, the costs. Like, they seem to be a driving group behind this, and because of their age, we can have such an impact on them. So things like graduated licensing and so forth, looking at before and after. I'm just wondering if there's any plans to look at provincial level data in the future.
Yeah, and so just one comment I wanted to make on the last point you made about the 15 to 24, which I meant to mention in my presentation. Transport incidents are the third leading cause of death for that age group, of all causes, not just within injury, of all causes after suicide, self-harm, and unintentional poisoning. So it is absolutely a critical issue within that age group, an absolute public health issue within that age group. In terms of the provincial data, that's a great question. In the previous report in 2015, we were able to break down by province. Unfortunately, this time we were not able to receive funding to allow us to be able to do that. We were only funded to do a national level report. What we are doing is we are connected with stakeholders in government and also injury prevention, nonprofits and centers and universities across the country, and having conversations about opportunities where we can create provincial level reports. And so, there are developments in Alberta and British Columbia, as well as some other provinces where we're discussing, being able to equip them with the data for provincial level reports. So we are working on it, but it is really a resource issue at this point, unfortunately. But if anyone has any strong desire and potential resources and opportunities to do provincial level reports, or territorial, we're absolutely happy to talk about that.
Perfect, excellent. And I've got another question. This is from Bella Dinzar, and she says, great presentations, thank you. Do the Vision Zero communities, this one's for you, Val, seem to want to focus on any specific or coordinated efforts, interventions for the new decade of action, or do they each have their own priorities? And just background information, Della is new to Canada. She's just started working with TURF. So welcome to Canada, Bella, and great question.
Yeah, great question. And looking forward to meeting you in person, Bella. So it's an interesting question because it really speaks to some of the findings in the Canadian landscape. Out of the areas and the cities that have adopted Vision Zero or are in process, everyone is going about it in different ways. There are some consistent interventions the cities are using based on their budget, based on their size. We are actually about to move forward with a Canadian Landscape Part 3. 3.0, where we're going to revisit all the groups that we met with who had adopted Vision Zero. We're going to circle back and find out how far they've come, what type of obstacles they've confronted. Do they have data for some of these cities that are in, 3, 5, 7 years of Vision Zero? And at that point, we were actually going to have a chat with them about what they're looking to do within the decade and how they're connecting their work to the decade of action. Because at Parachute, we think it's quite important to get engaged within the decade and to make sure we're all working towards some of those goals outlined. Also, just very quickly alongside that question, Parachute actually convened a series of roundtables recently where we brought 25 stakeholder groups together, including TURF. These groups were from environment, urban and sustainable cities, public health, active transport, and chronic health. And we all talked about some alignment within the work we're doing and how our work connected directly to some of the sustainable development goals and the decade for road action. Those findings are going to be released in the next month or so. And certainly there's a lot of room for collaboration and partnership amongst those groups, which is exciting because I do think it's really important to engage as many sectors as possible in the work we're doing. So I think lots of follow-up, Bella, between ourselves and you and your new role at TURF. So looking forward to it.
And I just want to thank you, Val, for answering that. And thank you, Bella, for that great question. And just another plug again for our conference. The theme of our conference is collaborating on achieving the goal for the UN Decade of Action, which is 50% by 2030 reduction in serious injuries and deaths. So this is going to be a main focus of our conference, which is going to be next June. But obviously there's a lot of time between now and then, and we will be putting resources on our website to do with the UN Decade, the global plan that was just released. We will have that available. So we will start to have more resources as time goes on to help people collaborate and also just learn more about what are the goals for the decade in the global plan. And I had, we're getting close to the end of our time here. So you had mentioned, Val, about a scan of the literature that you did with your Vision Zero landscape that you just talked about. I'm just wondering how that kind of got incorporated into the landscape, and is there a separate document that kind of lays out evidence-based countermeasures, that kind of thing?
Yeah, I can share it to you, Brenda, and then perhaps you can share it to the larger group.
Sure.
Some of the language and background certainly got integrated into the landscape document. And we did do a separate document looking very specifically at interventions on Vision Zero. So those are all on the professional resources side of our website. So if you're looking for anything kind of focused on implementing Vision Zero, as well as the interventions, that is on the professional resources page for Vision Zero on our site.
Perfect, and definitely I will share those links. Now this is just a very basic question. You said that you interviewed 14 jurisdictions, but you reported on 24. I'm just wondering how that happened.
Yeah, so that was literally trying to reach our policymakers in government and our city planners and so forth. So we were able to set up interviews with 14 people at those cities. A number of the other cities contributed to the report. So of the 24 that didn't take part in interviews, they contributed by sending us all their resources. We went through all the traffic safety plans, website reviews, and so forth. Yeah, so a lot, and that was part of the scan and the literature review was literally going through these documents that we were sent. Yeah.
Lots of great information. Thank you so much. And we're actually at the end of our time. And I just want to thank again, Valerie and Steph for coming out and sharing this great information with us. And stay tuned, everyone, for another great webinar, which will be planned. We're getting close to sharing that information on our website within the next week, and it will be around the end of November. So stay tuned about that. So thank you very much, everybody, for participating, and have a great rest of your day.
Thanks, Brenda.
Take care.
Thanks, Navoda.